Good morning, everyone, and welcome once again to our podcast series. This is the Compass One podcast series at the Visit Connection Summit in beautiful Wynn Hotel in Las Vegas. Welcome, everybody, to the stage. We are going to be talking today about leading in sustainability and population health. And I have three experts here with me. We're going to have a great discussion about this very important topic. Joining me down there on the far is John Utek. He's the Senior Director of Sustainability and Strategy for the Cleveland Clinic. John, thanks for being here.
My pleasure.
Next to him is Christina Inaveri. She is the AVP of Environmental Sustainability for Vizient. Welcome, Christina. And then Marissa Golison, Director of Sustainability for the Compass Group. Thank you guys for being here today. We talk about hospital food. What's the current state of hospital food, John?
I think it's a really exciting time in hospital food. I think it's in this amazing time of transformation. And when I say that, what I mean is that people come to hospitals for healing services, and sometimes they're in their most vulnerable and desperate states. And hospitals have woken up to the fact that food is part of the healing process. When they're on our property, getting food, it's medicine, it's part of their healing process. And what we ingest is a huge part of how we stay healthy. So what we serve our patients is vitally important to the success of our work as a healthcare organization. And we really see food as, this has changed from just feeding our patients to food kind of as a population health strategy for our organization.
At Vizient, we have 5 foundational areas that we refer to as our core tenets. These are intrinsic benefits, or table stakes, if you will, for all of our provider and our supplier partners. And they represent our social responsibility. So John talked about population health. And they represent 5 key strategies to solve for some of today's toughest challenges, whether it's health equity, population health, climate change even. I mean, these are huge, massive undertakings. And our core benefits are 5 foundational areas that focus on environmental sustainability to improve human and environmental health, supplier diversity, for its correlation to economic benefit and community health, supply assurance for high, reliable care, price assurance for affordability, and last but not least, insights and intelligence for informed decision-making and visibility. And these are integrated within everything we do. We do with our partners and our suppliers to advance any of the items I mentioned, from health equity, climate change, and even supply disruptions and items of the like.
Yeah, I think just echoing what John said, this is an extremely exciting time, especially working within the food systems and with amazing partners like Cleveland Clinic to say, how can we think differently about the food that we're providing, not only to help combat climate change, as we know that the food industry has a major opportunity to be a solution to a lot of the climate challenges that we're facing, but how do we use food as medicine? How do we help heal not just the planet, but people through food? And I think that the understanding of that intersection is really coming forward to the mainstream, and just the massive amount of information available to consumers. And with our types of partnerships that we're able to leverage the expertise with the culinary leaders and the registered dietitians and the wealth of knowledge within Compass One to support populations within the healthcare environment, I just think that there's so many opportunities for us to do better in terms of the food that we're providing, and also the entire ecosystem around the food, and educating people and bringing them along this journey with us, not only just in the hospital, but how can it be continued on within their home, as we know that diets are going to be incredibly important to sustaining the healing journeys that are happening in the hospitals. And the stat that I'll throw out here is that we know that 64% of the population now understands that what's better for them is better for the planet in terms of the food that we consume. And I think that this is an amazing moment for us to build upon in terms of how we can engage the populations in the food that we're providing.
I know, John, that the Cleveland Clinic won the 2023 Top 25 Environmental Excellence Award from Practice Green Health.
Thank you very much. Yes, we're very honored to have done so.
Yes, that's
Thank
awesome.
you.
Yeah. Why is your sustainability food service policy so important to your success?
It's interesting. So I've been at Cleveland Clinic for 10 years. I manage about 10 different issues. And since I started, we've taken on food as an issue. Why? because I see it as so profoundly impactful. And actually it touches on so many aspects of how we as a healthcare system think about what keeps a population healthy, right? So you look at research out of University of Wisconsin about the social determinants of health. 40% of health outcomes relate to where you're born, zip code, right? Social factors, things like that. We have programs that try to impact that. In fact, food is one way that we try to impact that, because frankly, the best health strategy for individuals is to give them a job if they don't have a job, because economic security is kind of the foundation of health and wealth. And we've realized and set goals and are managing them with our partner Compass and Morrison that we want to source more locally, because what that does is keep our own food dollars in the local economy. That does so many good things, because not only keeps a more robust local food economy, more jobs, taxes, there's ancillary benefits of the money. And you look at different studies and you get different outcomes, but there's a factor of 2 to 4 times more money kept for money spent locally than spent other ways. Just in terms of the local multiplier effect of, I'm a farmer, I get a haircut, there's just this multiplier effect of money staying in the economy. So frankly, that's a really important thing that we can do. And when I started, that just wasn't a focus. So working with our food service partner, we'd be able to do that. What's great about being with these 2 amazing women is that this is a team sport. Like, sustainability is all about working together. Even if Cleveland Clinic could become the greenest hospital in the world and have 100% local food and all that, that would be amazing. But frankly, we're here to change Ohio and the US and the world. And we do this by working together and talking together. And so really in tackling food, what we've done is, in flipping the script, we set some goals and we started to manage them. And again, I've been here, it took me 3 or 4 years. I think we set our goals in 2017 around a couple things. One is trying to buy more local food. Second, buy more sustainable food. And by sustainable, I mean typically has certifications of organic or sourcing or humane care of animals. There's a variety of different ways that you can sort of look at how food is actually prepared or provided, right? And all those are, those are just parts of the way that we sustainable is another way to make the world healthier, and look at, if we are organic in where our foods come from, the soils are healthier. Organic agriculture eliminates unhealthy chemicals, it creates biomes of microorganisms. We actually now have a functional medicine institute that looks at health from a 360-degree viewpoint, and they look at things like chemicals in food and there's all these different things that impact health, not just the direct disease and surgeries that take place in hospitals, but there's this broader perspective that our clinicians are starting to include. And that's why we as an organization are trying to manage towards those same goals.
It's interesting when you talk about like the teamwork of working with these ladies, but then you talk about the farmers and they're buying in and using the right chemicals. It really is a team effort, isn't it?
100%. It takes a village, as we all know. And as John so eloquently said, there are so many incredible opportunities within food, whether it's local sourcing to partner up with diverse suppliers so they have a living wage for their families, in addition to job creation and money going into the local economy, as John stated. It's also a reduction of carbon emissions to fight climate change. We know that's a top trend these days. It's meat reduction, it's even sustainable choices, so switching from a conventional product to one that is organic or antibiotic-free, and even food serviceware. So John talked about eliminating chemicals of concern. We know that, unfortunately, there are chemicals of concern in some of our plates and utensils and cups that leach out and are associated with adverse health outcomes. So many incredible opportunities, and as John said, the key is the multiplier effect. So by one decision, if a provider, the Cleveland Clinic, who is doing this on a daily basis, and Vizient helps to partner with Compass and Cleveland Clinic and our providers to showcase that there are options. One decision to partner with a local diverse supplier, you can have healthier food that's more nutritious, it's not traveling, job creation, local wage, carbon emissions reduction, and your patients and staff are healthier because they're getting that nutritious fuel. So it's just so many incredible wins, and so excited to be able to expand on some of these great best practices this morning.
And I'd love to add to 2 points that you both brought up here. The first in regards to, John, the 10 different things that you're managing on a daily basis and the collaboration that goes into solving for some of the world's most existential challenges, and the role that Vizient and Compass plays in supporting organizations like the Cleveland Clinic. And it's like, we do food, we know food, and being able to really own what you know you're responsible for and bringing that expertise to the table and saying, here are the things that we're able to track on behalf of Cleveland Clinic. Here are the things that we can really push the envelope on. Here are the things that we can really drive if we're able to do it in partnership with you. And I think that emphasis on the partnership with you is so critical, because so much of what defines what we're able to accomplish within an organization, it really comes down to who's leading it from the client side, and what are the priorities that your organization has set, because there's so many competing issues going on within a healthcare system every single day. And so it's making sure that it continues to stay relevant and part of those conversations every single day.
I got to tell you, you asked the question about this award, which we were honored, and I've been here 10 years. It's the first time we've ever won this top 10 award, which is, top performance in the country. It's a great honor to get that. And why do we get it? Because we've accomplished things that I sort of couldn't have even imagined when I started this 10 years ago, okay? I knew change was possible, but sometimes things go better than I expect. And when I joined the clinic, this was not my area of expertise. I've learned so much, but having my ability to do this is impossible without the support of my own leadership and management team. So I talked to them for a couple of years, and they agreed, and this makes sense. And this kind of aligns with how Cleveland Clinic thinks about taking care of its community and its patients, right? We kind of have these different services that try to impact things in different ways. But we have another commitment, which is measuring carbon from meat. We've reduced the carbon footprint of the meat served at our main campus by 41%.
Wow.
Impressive.
5 years, which is, it's incredible. And our food scores are great, like nothing has changed. We've been able to manage it that way. And it's sometimes in the issue of carbon, it can be discouraging. We can sort of get down and we need to go 80% or 50% by the end of the decade. Here we are at 41% in 5 years. So in the healthcare industry and what we couldn't do any of this without Vizient, who gives us the data to manage it, because in hospitals, people like me are few. So we need people like Vizient to talk to vendors, make it clear our social and environmental needs, get us data, and lobby in the Vizient contracts for getting environmental clauses in there. And they've been doing a tremendous job. The change, frankly, in that world in the last 6 years is incredible. It's sort of night and day in terms of my ability to manage. So that's incredibly helpful as well. But, anyways, incredible outcome. It's really just my team setting goals, having the Cleveland Clinic leadership team work closely with, and you guys just have such tremendous experiences. It's made it tremendously rewarding and successful.
I have goosebumps. I'm so glad this is being recorded. It makes my heart sing. 100%, John. I mean, I think of your carbon emissions figure, which is truly astounding. I mean, you don't hear that every day. People are talking about the world's on fire, we're never gonna get there. And to hear figures like 41% within 5 years is truly incredible. And we believe, honestly, that Vizient, due to our unique position in the industry, we are a convener. So our vision and mission is to convene providers, suppliers to create closed-looped, robust processes for data sharing and analytics, because we know so many of our providers are setting baselines, tracking goals, and it's huge. Sustainability is huge. And then you drill into food, and even that is massive with meat and chemicals and beverages and so much more. So really just kudos to you. I so appreciate our partnership, and Marissa, you as well. I know you're on our sustainability task force, and we meet monthly to talk about how do we convene and aggregate data and showcase transparency and visibility and embed it into all of our tools and resources, so that if someone asks about sustainable food or even sustainability, it's a one-stop shop.
Yeah, it's all about making it easier, more accessible, so that the average operator, the average business has the tools to be able to tackle this on their own, because they don't all have a John. And making it just easier for the layman to just pick up and say, okay, we're going to set a sustainability goal, we're going to set a climate target, and how are we going to get there? And so these types of partnerships and showing that it's possible, I think, is incredibly important.
I just see the passion in all three of you. Like, there's just a passion that comes out of you when you start talking about this. And when you have, I firmly believe when you have passionate people and everybody buys in, anything's possible. And you guys are proving that with your carbon footprint numbers and everything else that's happening. But I do want to ask you, Christina, I'll start with you, the future of sustainability when it comes to what you do at Vizient and where you see it going.
The future looks bright. No matter what everyone hears on the news and the media, it looks bright because there has never been so much energy and momentum around this. People are leaning in like but never before, and we are seeing so many innovative collaborations with providers, suppliers, GPOs, NGOs, and so many more players who say, we all want the same things. We want to ensure that our communities are safe and healthy, and we can look at social determinants of health, and we can improve patient satisfaction. And John said, engagement. It's also, food is incredibly emotional. It makes people feel great. So the future's bright, the opportunities are endless, and it's because of amazing leadership from John and Morrison, who are leaning in and are saying, what else is needed? What can we do? How can we work together and collaborate to push this forward and advance sustainability performance improvement?
We have so much that we're doing from a supplier engagement perspective, operational efficiencies, and just running our businesses better and more sustainably. But I think the big one for me is what we've been talking about, John, is the consumer and guest engagement, and bringing them along this journey with us, because they are arguably one of the most important stakeholders in this conversation. You're not able to have success in the plant-forward taco shop if people aren't buying the tacos. And so I think it's the really exciting thing for me in terms of where we're going in the future is how we're going to engage the guest in this journey with us and educate them and empower them. I think that, to your point, Christina, there's so much doom and gloom around messaging in regards to climate change, because it's a really daunting topic, but there's so much positivity that we can bring through food and making delicious culinary experiences, which I have the opportunity of working with amazing chefs every day and being able to show what we can do. It's not just the black bean burger anymore in terms of how we talk about plant forward, and that we're not trying to remove meat all in all, but a little bit less, and thinking about how can we actually just increase the amount of plants on our plate and really celebrate the local and the seasonality of the food that we're eating. I just think that the mainstream understanding of the food system is growing so much right now, and it makes me extremely excited because for so long, people have been so far removed from the food that they're eating. And I think that, it does a disservice from a culinary perspective, and it does a disservice from understanding the health and sustainability of the food that we're eating.
What would you say to other people out there as far as to how to really dive more into the sustainability efforts in their hospitals or what they're doing or the partnerships? Where does somebody do? Give us some advice to say, hey, this is what you need to do. This is a good place to start.
There's a growing number of sources of great information on how to get involved in sustainability in healthcare. Certainly, even if you just go to Compass Group's website, they have an amazing report, a great story. Vizient does as well, by the way. They report what they're doing. There's a group called Practice Green Health that's sort of an umbrella organization that sort of is great at just sort of trying to package up, hey, here's all the things you can do in healthcare. That's the award that we won. The application has a lot of questions on it, including a lot of questions on food. But really what it does is if you're getting started, here's I'll say it's more than 100. I'll just say it's 100 things you need to do, because it's lots of things, but that process gives you kind of a roadmap of where to get started and how, and most importantly, really a network of people to talk to. Because doing this work, varies. Every system every hospital is a network of people, and they have different ways of understanding. So finding ways to kind of find the key leverage points in your system. And that's really what Vizient's doing the same thing in terms of green purchasing, in terms of trying to provide new members with the tools to manage the way that they do green purchasing. So I'd say that, good kind of general, if you want to really get into the topic, which is purchasing, Vizient has both tools at the corporate level for understanding how companies are, what their companies are doing, but also individual product level, what have the green attributes and what don't. And they now have like 150 million more attributes than they did 5 years ago. Maybe that's not the exact number, but something like that.
Close, very close.
So that's helpful for us to be able to manage stuff like that.
Christina, what would you say?
I would say now is the time to start. There is not a better time to lean into this than now. I know many providers and even suppliers say it's overwhelming, it's so broad, we don't know where to begin. But Vizient provider best practices and case studies are available. Compass has so many incredible articles, blogs, case studies as well. And what's important is to start somewhere. So you don't have to tackle carbon and meat and beverages all at once. Every single small step helps. Every single step and every change is still adding to the big picture, and it's still advancing sustainability performance improvement. It's elevating the cause. Our providers are stepping up as champions. So many great resources, and I just end with, please ask, just reach out. There are so many tools available. I know for us, we use data and analytics as the foundational component, as John mentioned, whether it's dashboards or optimized insights or catalog or environmental preferred designated portfolios. But we can always get creative, and we're always willing to lean in. But now is the time to really get started and act.
To get started, I think it's really figuring out what's important to you as an organization, what's important to your local community, what's the issues that are going to be most material to the people coming into your hospital every day, and how do you want to tackle that? And I think just finding the right partners who are willing and ready to be on this journey with you. Journey is the most overused word in the world of sustainability, but for good reason, because this is going to be a journey, and understanding that the power of scale and those small changes really do add up.
Yes, for sure. I have to tell you, this has been one of my favorite podcasts we've done so far in the last day and a half. We got a bunch more this afternoon, but you guys, I love the passion. And I know we could sit here and probably talk for another half an hour easily, and we would just be just as energetic the whole way. Right, at minimum, right? Maybe the rest of the day. But thank you so much, John, Christina, and Marissa. Thank you so much for joining us on the Compass One podcast series. I really appreciate you being here today, and enjoy the rest of the conference.
Thanks for having me. It was a pleasure. Thank you.
You're welcome.
Thank you so much.
You're welcome.